Okay, so we are back for day 2. So we're back on day 2 of our Masterclass series. So today, or this week, so for another couple of days, for those of you joining us on this series, we are talking about the influence of different factors that can affect how our core strength works. Yesterday we talked about our core strength being our tightness of our abs. So we're looking at the deeper tissues, so the tissues of our rectus abdominis, so our six-pack muscles, the obliques that work either side or deep to those six-pack muscles, and the muscle called the transversus abdominis muscle, which goes across and the fibers run horizontally. And this is sort of the key, or one of the key things that we need to be aware of, is that that deeper muscle, the transversus muscle, basically sucks everything in and back, and that's the muscle that a lot of us find a lot more difficult to activate. So when we're looking at our more superficial muscles, so our rectus abdominis and our oblique muscles, they're the ones that we think of as a moving muscle. They actually cause our body to move. And if we think of the transversus, that's a muscle that is supporting us. Okay, so it sits across the belly this way and it sucks everything in. So if I lift that up a little bit for you, it's just holding everything in. So if you think of a corset for your abdominal muscles, that is basically it in a nutshell. With various things which you talked about yesterday, so specifically today we're going to be talking about what we call a rectus abdominis diastasis, or an RAD, which is basically a split in the stomach. So this is quite common in a lot of people. You'll find if you've had pregnancies that post-pregnancy you might have a split in the stomach. You might even see, if you notice, some of the pregnant women have a little bit of a gap or a channel down the front of their tummy. That is an active or a split in the tummy that you can see while baby is still in situ. And then post-pregnancy, obviously either through natural delivery and the effort or through the massive weight gain, you might end up with that diastasis post C-section as well. So what we need to do is check if you have a gap in your stomach. You're not going to be able to activate your core. You're not going to be able to get muscles moving. It needs to be specifically trained. So this is one of the reasons why, if you're doing abdominal exercises or you're doing strength work, or you have had a back problem, you might find that your core isn't working. You might find that actually you have a split in your stomach. And that inherently can have been there for years. So, we've definitely seen women who've had, babies, and their babies are now teenagers, and they're still left with a gap in their stomach, and they're still wondering why they still have that sort of squidgy mummy tummy that just doesn't appear to get toned no matter what they do. So in order to ascertain where you're at, we're going to first look at how to find out if you have a split in the stomach. So if you think what we're looking at is your abs. So if you're looking at your abs and your six-pack abs from below, I just put myself up on this little thing here. If I've got my abs running from side to side, I should have just that tiny gap in them. So when I sit up, everything stays controlled. Now, if I have a gap in my tummy, it means that there's a little bit of a gap and a hole in there. And when I sit up, that hole can get bigger or that hole can close. So what we need to ascertain is what's going on. If you are having a gap in that stomach, when you then use your abs, is that gap closing, and is it actively then supporting you? Or as you come up into your sit-up or you activate your stomach, is that gap pulling apart? Okay, and that's one of the biggest things that tends to be a bit of an issue. I'm just going to go and grab, actually, do I have a headboard in here? I'm in our reformer room today because we have a class going on next door. So if you bear with me, I'm just going to lie myself down. Okay,
So if I'm lying down, okay, what I'm looking for is I would always do it with a bit of head support behind you. And then remember with your six pack starts just under your rib cage. So if you feel for the bottom of your rib, and it comes around the bottom of your rib, and if you feel for the bone just between the legs, so just at the top of the pelvis here, we don't skeleton, we're going at the top of the pelvis here, where you feel your bone attachment or the bone end of the pelvis is. So we're looking in that section here. So your top of it is going to be your base of your ribs. Then the middle section of it is going to be your abdominal, your basically your belly button, so your upper locus. And then the lower end of it is going to be your bone. Okay, so it's along that line. And then remember that we've got two sides of that. So we're looking at either side of your leg. Okay, so what I want you to do is just pop your fingers right in the middle of your belly button. Okay, and if you can, pop your fingers sideways on, so they're not lengthways or sideways on your tummy. And you basically just want to press into your stomach, make sure everything feels nice and soft. And then I just want you to lift your head up. Okay. Place two fingers. I'm going to lift the head again. Is just feel like it's springy and it's got some activation into it, or does it feel like your fingertips just squeezing? Okay, so if I've got tension and my muscles aren't working, I'll feel that it feels quite firm and it's hard. Even if you've got a little bit of sort of excess skin over the top and it feels a bit squidgy, you should feel that actually, yes, I can feel there's some tone and there's some tension there. Okay? Now, if you curl up and you lift your head and start to lift your shoulders up, and you can't feel that there's tone, just move across until you do feel that there's tone, because what we're looking for is the edges there. Okay? Hands to the gap. If you feel into your tummy, breathe out, and neck and chest comes up. You're going to feel, and if you can feel like a one finger gap, maybe even like a slightly bigger than a one finger split gap, that's okay. If you remember when we're looking at the pictures, you've got your four sets or your abs, and there's those little digitations of muscle, and there's the linear element that comes down the middle. So if you can feel like a little bit of a gap between them, that's fine. What we're looking for is something that's 2 fingers or more. So if you again dig your fingers into your stomach, pop your hand behind the head if that's easier for you to do, and then breathe out, head, neck and shoulders come up. And then we're looking to feel, do you feel edges of the muscle? Okay. Now, what will happen is as you're coming in, so if you're coming into your sit-up here, if I curl into my sit-up and everything is fine, I might feel that there's just a bit of a gap between that. Now, if I curl into my sit-up and I have a gap, I might actually feel that I could get 3 fingers or 4 fingers. And then what we're doing is feeling for the different edges of the muscle. So instead of your edges of the muscle being relatively taut and you've got minimal gap, you might find that there is a decent gap between the edges of the muscle, and you can get a few fingers between them. That's what we call a diastasis. So basically what's happened is the edges of the stomach haven't knitted back together fully. Okay, now that doesn't mean that it's a big problem. Obviously we worry about this. What we need to do is build up tone in the muscle so that the muscles activate and start coming back together. So instead of the effort and you putting too much effort which pulls them apart, we want to make sure that the effort brings them back together. Okay, so if I'm lying down and I'm doing a lot of sit-ups and a lot of exercises and I'm pulling up and my tummy is closing and I'm able to control it, then that's good, because what I'm doing is I'm getting the activation and it's closing. Now if I'm doing the effort and I'm curling up and I'm getting the pull apart, then that's not helping me at all. It's not getting those muscles to work to support me. It's putting too much strain on them and they're failing and they're pulling apart instead. Okay? So if you find that you have a split, the key things that we're after is how wide is that split? How do you feel it? So if it's 1 or 2 fingers, that's generally okay. 2 and above, we'd want to be doing something about it. Probably think about just working that a little bit more secure. Around them, might be a little bit of a gap anyway, because obviously that is that button. What we're looking at is down, down below. Curl up and see how far that is, and then we're feeling how far that is coming. So when from a video point of view, when we're looking at it, I might check, curl up, and I might just get actually higher up, 2 or 3 fingers, around here it might be 5 fingers, down below it might be 2 fingers, or vice versa. So we're trying to get how much width it is. Now, incidentally, if you are struggling with pain, so you have back pain, if you think this is supposed to be the corset or the muscle that supports your back, if it's in here and it's not holding it and supporting you so you can then move, you will put excess strain on your back because your back is working harder. But the other thing that you need to be aware of is that if you are working and you put excess strain on it, it's going to bulge outwards, in which case it's going to pull apart again and it's going to give you more strain. So commonly with people who have problems and they do have a diastasis and they do have a stomach split, you will find, like we were talking yesterday, you will fatigue a bit more quickly. You won't be able to do the crunches and the sit-ups. And also when you're doing the crunches and the sit-ups, you're not going to be activating these muscles well. So when you're doing all these crunches, you're ending up using your upper abs, and you end up with that elbow below that's not working and it's not activating to pull everything behind you. So this is one of the big causes of why the stomach might not be getting flat, or you might feel you're not getting that tone and you're not getting the results you want, is because you're not activating your core well. So reason number 1, if you've got a split in the stomach, and you're looking at it and you're activating your stomach and the split is there and it's not closing, you're not active through your core, and what you're doing is you're over-stressing it and you're actually making it dull, or you're making it worse. Okay, so in terms of worse, we're talking you're not getting active, so the core's not getting stronger, so it's safe. The second thing is if you are weak here, you do have a diastasis, if one of you are doing putting more pressure through the pelvic floor, which again we talked about earlier, or yesterday rather, but if you're putting more pressure and you're putting that downward pressure on the pelvic floor, then you're going to find that everything is getting weaker because you'll tend to tuck underneath, you'll tend to be pulling everything and you'll be compressing everything. So instead of getting it where you do a chest lift where you curl up, you're going to be doing it where you get a chest lift where you crunch and everything is pulling in tight. And again, that domes the stomach as well. So hopefully that will give you a little bit of insight into what to look for if you have a diastasis. So we're looking for a split in the stomach. We're then looking for how long is that split, how wide is that split, and then we're looking for if you try and activate the tummy, does your split pull apart, or does your split start to come together and you can start to hold and maintain that, because that is where you need to be if you want your core to then work more. Thing we're going to talk about is how to actually activate muscles. Okay, so if I'm lying here and my stomach is here, if I'm lifting a leg up and placing it down, or if I'm doing a chest lift, I want my stomach to stay flat. Okay, so where my stomach muscles are here, if I'm activating them and I want my core to be switched on, I want it to stay where the muscles here stay flat and even draw away from my fingers. I don't want to be thinking of sucking everything in because the soon as I suck everything in, I get a curl, and you can see my whole pelvis tilts. And I'm not actually using my core muscles then. All I'm doing is tilting my pelvis and pulling my belly button up to get my stomach to suck in, or to activate rather. I just want to feel it tightening across. Now what will happen if I'm not active, if I can hold that position and float my leg up, my stomach is staying still, my pelvis is staying still. There's no curling, there's no activity going on. Same on the other leg. If I hold everything, my stomach stays still and I'm not activating anything. If I'm at the point where I'm loading my stomach and I'm causing too much pressure, then what's going to happen is as I curl up, my belly's going to push out. So if you put your hands on your tummy, or a hinge prepare, exhale, think of just tucking your rib cage under your waistband. My stomach's going to brace upwards, okay? So we're looking for that flattening, we're looking for the control, we're looking for our belly not popping up into our hands. The same thing will happen when we're lifting a leg. We're lifting a leg and we're wanting to make sure that our stomach stays still. So this is one of the big problems that we have when people come into Pilates classes. We're asking them to lift a leg up and float it down. And we're thinking, well, it's not, I'm not doing it, nothing's working, nothing's happening. And what's happening is they're just doing this, just lifting their legs. Actually, because they want keeping it still, keep everything flat. So I want to make sure that my stomach is staying plain. I'm not curling, I want to make sure I'm not pushing through the legs, I want to make sure I'm not tucking my tail in, I want to make sure I'm not bracing. I'm just thinking there's a balloon on my knee, and I let the balloon float my leg out. Okay, my stomach will stay relatively stable. I float the other leg out. My stomach stays relatively stable. Now, if I'm floating it out and I'm making more of an effort, you can see if that's too hard, my back's arched off, my belly's popped up, and I sit down with my bottom. Okay. Now, if I'm thinking about the two hip bones, two of my hip bones side to side, and I'm thinking there's a tiny string or a lace, and I'm just going to tighten that lace if I can. So I'm going to activate here. As I breathe out, I'm just going to think about tightening that lace between those 2 points. Without those bones. Into there. Force them down. If it's working too hard, my belly's going to dome up. I'm going to really see that move up. So when we're active through our tummies, we want to make sure that the tummy stays flat. When we're working too hard, the tummy pushes up into our hands. Okay? So that's the 2 things that you sort of kind of need to be aware of when you're working with your core, is as you're moving your core and as you're doing things, is it being controlled? Are you able to activate your core, and is it being controlled? Are you able to maintain your tummy and lift it up? So 2 reasons that you might find you're not getting your flat abs. Your belly might have a split in it, in which case if it does, we need to know how wide is the split, how long is the split. If you are actually active through your tummy, are you able to get it where the tummy and the muscles are active and they're coming together? Or are you finding that as you're active through your tummy that it pulls apart or it domes? Okay. Second thing is when you think you're working your core, are you actually working your core or are you bracing? And if your belly's popping up, you're bracing and you're using something else. If your tummy's not staying flat and it's a nice control that you can move the leg without the tummy having too much movement in it, and anything it draws in towards you a tiny way, as opposed to what we call a doming out, then you're working your core if you feel a slight moving. If you feel that it's pushing out and you feel your belly is out, and that would be the same in any exercise. So your chest lifts, your sit-ups, your planks, anything that you're doing where you feel your belly is being pressed out, then you're not active through your core because you've let go of it, you're not working it. And with those, that needs to be a graded increase in what we're doing. So we need to make sure that as you move and as you improve, the actual core strength improves. Now, if you have
If you're working your core well, it should take a lot of effort. It should take you some time to be able to say, okay, I'm breath in to prepare, breathe out, I'm keeping my leg up, I'm holding my stomach still, breath in, breathe out, lift the second leg up, I'm trying to keep my tummy flat. It shouldn't just be that you can lift and lift and lift, and it shouldn't just be that you can crunch and crunch and crunch, because you need to be able to think about holding everything and maintaining everything. So this is where we sort of have a disconnect with trying to do as many as you can. There's no point trying to do 30 sit-ups. There's no point trying to do 30 crunches. I would rather you did 3 crunches and you did them well, because then you're going to be active through the right muscles and training the right muscles. And if that muscle hasn't been able to work and that muscle's been inhibited and it's not working and it's not used to working, it's going to take a lot more to actually tone the other muscles down and allow this one to build. Okay, so when we're talking about inhibits or inhibited muscles, we're talking that, you know, you've either had your tummy split, so your muscles have forgotten how to work and they're not working. We're talking that you might not have done exercise for a long time. We're talking that you might not have been using those muscles because you've had previous surgery, or because you've gained a bit of weight, or because you have had back pain and the muscles have become what we call inhibited. And that inhibited state means that we haven't used them and they've forgotten how to work. They've become so weak that they now don't know how to work. So going from so weak to planks just doesn't work. You're same as you running, same as anything. If you haven't ran before, you're not going to go, okay, I'm just going to go and run 10Ks, because it doesn't work. You start slow. You start going, okay, well, I'm going to walk for 5 minutes, and then I'm going to walk for 10 minutes, then I'm going to walk, and then I'm going to run for 30 seconds, then walk for a minute, run for 30 seconds, then walk for a minute, then I'm going to run for a minute, walk for a minute, now I'm going to run for a minute and a half and walk for a minute, now I'm going to run for a minute and a half, walk for half a minute, and you build it up gradually over time till then you get to the point where you can run 10Ks. So the core muscles are the same. They're still going to fatigue. And generally, if you think about your core muscles as what we call a control muscle. So what we're after is that you're after being able to control the muscles. You're not after doing as many as possible. So I generally look at people and say, look, your core muscles are either going to be working for you or they're not. You're going to try and do something, and you're going to be trying to do a sit-up or a chest lift, as we prefer to call it. So we're lifting rather than crunching, and because you do your chest lift, your body's not sure what to do, so it just doesn't work and it feels all weird, and then you suddenly get it and it's like, oh, okay, now I know what I'm doing, I know what it should feel like, and then you might manage a handful and then you just lose it again. So I tend to think that, you know, your core muscles are working or they're not. You'll feel that you've got it and you can hold it, and then it just doesn't work. Same thing happens if you're exhausted, if you're really tired. Just from experience in the studio, if you're really tired, it's really hard to then support yourself and have that deep structure and that deep posture control, because your muscles just fatigue and everything fatigues out. So if you're thinking, am I active through my core? If you're feeling that whenever you're doing something, your belly's bellowing out, then no, you're not active through your core. So you're not able to get that control back. If you're feeling that there's a gap in your tummy, and you've got that gap in your tummy and your tummy feels a bit jelly-like and it's really hard for you to activate, and you have a feel and you can feel the edges of your stomach muscle, and again, it's that sort of definite edge around the stomach muscle, then your stomach's not active and it's not coming back together. So can we do anything about those problems? Definitely, yes. There's a whole heap of things that you can do to try and get those muscles working again. It's not, unfortunately, as simple as just going, I'm just going to go and do crunches. I'm just going to go. There's some baseline. So your crunches and your planks are here. If you have a muscle that's inhibited, so it's not working very well, or you have a stomach diastasis where you've got that tummy split, your start point is down here. You need to start at ground zero. You need to start right at the basics in the beginning, and starting at chest lifts and planks, that's too hard. You're not ready for that. You need to be able to lift a leg off the bed. You need to be able to gently control your movements without everything moving with you. You need your stomach to come in with your muscle that works, and bringing in your obliques, and then bringing your rectus abdominis on top, and having them all trying to do everything together is generally too much load, and that's why most people fail. And that's why most people, when they're trying to do that exercise and they're trying to do that their stuff that comes and gives them that support to give them that flat stomach, they haven't got the basics right. So any load on top then pushes it out even further, and any load on top then causes that to be an outward pressure, which is completely contrary to you wanting that support pressure. So hopefully that's cleared up a little bit. If you do have a feel around in your stomach, and it's not just for women who've had babies or pregnancies, you can find you have a diastasis if you've had abdominal surgery, because obviously they're cutting through your stomach to have abdominal surgeries. Quite common after cesarean sections, again, because they're cutting through the stomach muscle to have that. Quite common after rapid weight gain, because you gain weight and the stomach doesn't contain it and you get that split. So, and also quite common in men because of that reason. And men, we don't tend to see so much of a gap. Men will tend to get a little bit more of a tenting. So when they're trying to sit up, you'll notice that it tenses up along your center line of your abdomen as opposed to pulling apart. So there's like a little couple of differences in there, but there can definitely be diastasis present in both sexes. So hopefully that will explain a little bit more for you. Tomorrow we'll continue with, again, some core strength work and discussing how different things can affect your core strength. So hopefully you can join me again tomorrow. I hope you're enjoying it so far. If you do have any questions that you would like answered, please feel free to post it in the comments. Otherwise, we'll see you same time, same place, 12 o'clock tomorrow, which is Wednesday. So thank you for joining me. I'll just close that here.